Welcome to the tutorial on managing recommendations. This tutorial is the second in a series regarding working with recommendations during the patient intake. If you have not completed the tutorial Updating Recommendations During the Patient Visit, please make a point to complete that tutorial before proceeding on with this one. As you learned earlier, you will use the Recommendations section of the patient chart to update and manage a patient's preventative needs by satisfying recommendations in a timely manner. We will use patient reminders to generate letters to patients for health maintenance items that are approaching their due date or that are past due. These reminders will serve to meet Meaningful Use Stage 2 Measure 12. In this tutorial, you will learn how to record a patient decline for a recommendation, how physicians are able to reset frequency, how a physician can cancel a recommendation, and how a physician can postpone a recommendation. If a patient does not want to follow through with a suggested recommendation, it is up to either the clinical staff or the provider to decline the measure. From the Recommendations section of the chart, locate the item and click the Decline option. A Refuse window displays where you will enter the reason and any comments for the patient declining the item. Click the Reason drop-down. A list of reasons displays where you can select the reason for the refusal. If needed, additional information can be entered in the comment field. Clicking the OK button will close the window. You are returned to the Recommendations screen. The item is no longer displayed as a pending expectation and now displays as recently satisfied with a status of refused. Note: declining is not canceling. This item will reappear on the pending expectations list the next time it is due. If a recommendation displays on the patient's list and it is not something you feel applies to that patient, you have the option of eliminating anything that is inappropriate by canceling the recommendation. From the Recommendations screen, select the item and click the Cancel link. A Cancel window displays where you will enter the reason and any comments for why you are canceling the item. Click the Reason drop-down. From the list of reasons, select one that is appropriate, such as Not Necessary. With the reason selected, you may enter any pertinent comments in the Comments field or simply click the OK button. You are returned to the Recommendations screen. The item is no longer displayed as a pending expectation and now displays as recently satisfied with a status of canceled. Note: this item will not appear on this patient's pending expectations list again. Another option for managing recommendations is to delay or to postpone them. From the Recommendations screen, select the item and click the Postpone link. A Postpone window displays where you will enter the reason for the delay, enter the Postpone Until date, and any comment. Click the Reason drop-down. From the list of reasons, select one that is appropriate, such as Patient Request. The Postpone Until date is a required field. The date you select will determine when the item displays again in the Pending Expectations list. You can use the drop-down to select a date or simply type one in the field. With the reason and the date selected, you may enter any pertinent comments in the Comments field or simply click the OK button. You are returned to the Recommendations screen. In this circumstance, the Postpone Until date is still within the range for the displayed pending expectation. The high blood pressure screen shows as postponed in both the pending expectations and the recently satisfied expectations list. The last piece of managing an existing recommendation is to update or change the frequency. From the Recommendations screen, select the item and click either the due date or the frequency link. A Change window displays. You may either change the frequency or the due date for the expectation by clicking the appropriate box. In this example, we will change the patient's frequency for their colonoscopy from 10 to 5 years. Clicking the Reason drop-down allows us to document why we are making the change. In this example, we'll select Patient Risk Factors. With the frequency changed and the reason selected, you may enter any pertinent comments in the Comments field or simply click the OK button. You are returned to the recommendations screen, and you can see that the colonoscopy frequency for this patient is Q5 years. There is also an icon on the line indicating a customization has been made. Placing your mouse over the icon displays a tooltip. This concludes the tutorial Managing Recommendations. In this tutorial, you learned how to mark an expectation as declined, how to cancel an expectation, how to postpone an expectation, and lastly, you learned how to change the frequency for an expectation.